So to start for our assessment is first we do the hand washing to avoid the spread of microorganism and from contaminating and infecting. So next is to provide the clients comforts and privacy in this room. So to do that is we close the door, we fix the curtains, we adjust the room temperature for the clients or patients comforts and privacy. So next is we identify, we explain the procedure on our assessment. So good morning, sir. My name is Ronald James Liboni, your student nurse for the day. So can I verify your identification? So what's your name, sir?
My name is Octavian.
And your birthday?
December 1,
December 1.
2002.
Okay, thank you, sir. So for today, we will be having a bed bathing. So we are going to wash your body to remove any dirts and oils that was lasted in your body. So and to feel refreshed again. Is it okay for you, sir? Okay, so next is offer bedpan or urinal, then ask your client or patient to void. So before we start, do you have anything to void?
No.
Okay, thank you. So next is to prepare the necessary equipment in our assessment. So first is we have the wash basin with a lukewarm water. Then next is a washcloth, a bath towel, and a bath blanket, a liquid soap, a moisturizing lotion, an eyedropper, a deodorant, eye patches. These are the hair comb or hair brush, then working gloves. So first is we wear the working gloves. So next is if we are in a hospital setting, so raise the bed in a convenient height, then lower the side rails near to the nurse in a bed in a hospital. The next is assist the client to move aside near to the nurse. So sir, I will be assessing you to move a little bit from the right. Is it okay for you? Okay. Can you move aside, sir? Okay. Thank you, sir. So next is place the bath blanket above the patient's chest. Okay, sir. The bath blanket. Then next is remove the top sheets, the soiled top sheet. Removing this. Then place it on a hamper. So next we remove the patient's gown. So if there are any intravenous lines, injury, or reduced mobility, first is we remove the gown at the unaffected area. So sir, so today we'll be removing your gown. So do you have any intravenous lines or injury in your body?
No.
Okay, since there is none, so we can remove the patient's gown. So sir, I'll be removing it. So next is fill the wash basin with water with a temperature of 41 to 40 to 46, 43 to 46 degrees Celsius. So we fill it with 2/3 full. Then next is we let the patient check if the temperature of the water is okay for him or her. So, sir, can you check the water if it's okay?
Yes.
Is it? Okay, thank you, sir. So, next is we remove the pillow of the patient in his or her head. So, sir, I'll be removing your pillow. Okay, thank you, sir. So, next is we wash the face. So, first is we place the towel appropriately. So, we are using 2 towels. So, we'll be placing under the head and over the chest of the patient. So, assess the head of the patient so we can place the towel. So, sir, can you raise your head a little bit? Okay, thank you. And I'll be putting this one in your chest. Okay. Okay, thank you, sir. So, next is we wash the eyes and dry them thoroughly. So, by washing the eyes, we use the washcloth. Then we fold it correctly. So, in washing the eyes, use the side of the washcloth, then use the other side in using it to the other eyes also. So, sir, washing your eyes. Then dry it with the towel. So next is we rinse and we dry the face of the patient, the ears and the neck. So we'll be needing to wash. So sir, I will be wiping your face. Ears. And to the other. And your neck. Then dry it with the towel. So next, if the patient is male, so ask him if he wants a shave. For the unconscious patients, so we wash the eyelids, the eyes with plain warm water, then start from the inner to outer canthus, and use a new section of the cloth. So Next is, if prescribed, put some eye drop or ointment. Then, if there are no blink reflex, so keep the eyelid closed. So, next is to gently put the eye patch or eye shield, then close the eyes. Okay. Next is we wash the arms and the hands. So to start is we expose the arms of the patient. So, sir. Then place the bath towel lengthwise beneath the arms. Raise your arms. So next is we soak, we rinse, and we dry the arms. So starting from the distal to proximal area. Sorry. Then next we'll be washing the hands of the patient. So next is we repeat the procedure on the other hand of the patient. Then we dry. Then we raise the arms of the patient. To wash for the axilla. Then we dry with the bath towel. And we apply deodorant. Sir. Next is we wash the chest and the abdomen of the patient. So to begin with that, first is we spread out the bath towel and spread it over the chest of the patient. Then lower the bath blanket to the umbilical area. So next, so lift the bath towel off the chest and start washing the chest to the abdomen of the patient. So give special attention to any skin folds because they are prone to sweating and bacteria could lodge in that part of your body. So, next is to wash the legs and the feet of the patient. So first is we expose the patient leg by folding the bath blanket toward the other legs. So make it sure that the perineal is covered. Then place a bath towel beneath or under the leg of the patient. So wash, rinse, and dry the leg properly. So start from the distal to the proximal. So we are starting from the ankle to the knees, then to the knees to the legs. So wash. So we start from the distal to the proximal or to the knees. Then after we soak the leg, is we rinse it. Distal to proximal. Okay. After rinsing is we dry it with our bath towel. And now we are washing, we are soaping and rinsing, then dry it well the foot of the patient. Then dry the patient's foot and apply a moisturizing lotion. So next is do the exact thing we did on the other leg. Sir, can you straighten your other leg? Is discard the washcloth that we use on our assessment, then we maintain the privacy of the patient. So next is refill the basin with clean water. So then change the clean gloves. Then throw it in a proper way. So after we change our gloves with clean gloves and we change our water with new clean water, we are now washing the back of the patient. So in order to do that, so assist your patient to a side lying position away from me. So sir, I want you to move in a position like sideline. So, okay. So bath blanket must always be in this position to cover up the body of your patient. Then after that is we place the bath towel lengthwise underneath the back of the patient to the buttocks. Then we can start now washing the back of the patient. Now we are starting from the shoulders, going down to the lower buttocks to the upper thighs. Then pay special attention for any skin folds. So like I said before, it is prone to sweating, or it could lodge, bacteria could lodge in that particular area of your body. Moving to the upper thighs of your patient. So after that is we dry the back of our patient. Sir. So next is ask the client if he or she wants to massage his back. So sir, do you want to massage your back?
Yes.
Okay. So just position. So gently massage the back of your patient. Okay, thank you, sir. Now, go back to your original position, the way you did before. Okay, thank you, sir. So lastly is we help our patient to put on a new gown. So sir, this is your new gown. We will now be putting it your hands. So slowly remove the bath blanket. Lastly is comb the hair of your patient. So sir, do you feel refreshed right now?
Yeah.
So explain to me what you feel right now.
Very nice.
Okay, thank you, sir. That's good news. So, if you are in a hospital setting, so place a signal device near to the patient in order, if there are any emergencies, he can dial it fastly. Then lastly, before we end our assessment, is we do hand hygiene to prevent the spreading of microorganisms.